Good morning, Miss Waskin. How are you? Have a seat there. This is Miss Armila. I'm the registered nurse of this hospital. As you are discharging today, I'm gonna give you some health tips regarding the drug furosemide and how to manage it at home and how to take it and everything about this one. Okay. And also, I came across your concern regarding like whether these drugs will affect your active social life. You are a very active person, so don't worry, I'll just clear up your doubts. The doctor has prescribed 20 mg furosemide from once a day to BID for you. Actually, the normal adult dose is around 20 to 80 mg per day BID, but 20 mg is quite a less dose, and the half-life of this drug is around 1 to 2 hours. So after this period of time, the effectiveness of the drug will reduce. So make sure like you take the drug early in the morning at the same time as recommended by the doctor. And you can make sure like you don't take the drug before going outside. Outside you don't drink any caffeine or anything that will irritate a bowel, because that will disturb during your activities outside. And about your another concern, like your appointment hospital is quite far away. It's around 40 kilometers. Actually, the side effect of this drug, there will be like dizziness and vertigo. So it's not safe for you to go for the appointment all alone. You can go either with your relatives who can drop you up there and then pick you up back. So it's safe for you. If you are comfortable, you can even use the pad during that time period, which can prevent from the leak. And apart from that, you can use the sunscreen lotion 30 minutes before you go outside, because this drug is highly photosensitive. So to prevent any skin rash or anything, any allergic reaction to your skin, you have to put on the sunscreen. Talking about the drug furosemide, it is a loop diuretics. It is also known as water pills. It will act on our loop of Henle part of the kidney, which will help to excrete the water as well as some of the electrolytes, mainly calcium, magnesium, chloride, sodium and potassium. So you are in a close monitoring with the doctor. You have to do your blood test regularly and frequently, so as to know the level of electrolytes in your body and how this drug is acting on your body, whether it is effective or not. Based on that, the doctor will recommend you further doses, either to increase or decrease. And apart from that, you need to check your blood pressure daily. If the systolic blood pressure is less than 100 mm of Hg, you might consult with your doctor, because with that you will have like orthostatic hypotension. As soon as you get up, there might be a risk of fall. So while getting up, you get up slowly and change your position slowly, so that there won't be any risk of fall. You have to avoid the food rich in salt, as well as other salt substitute and deep fried food, burgers, cheese, etc., which are rich in the salt as well as the fatty food, because this drug will leads to the because this will further increase your blood pressure. Check your weight daily. If there is changes in the weight more than 1 to 2 lb, inform to the doctor as soon as possible. The peak effect of the drug is 1 to 2 hours. So if you miss the drug, do not double it up. And if you are at home, take the drug as soon as you remember. But the thing is, like, if you are outside, do not take it, because it will disturb your daily activities. And you have to avoid the OTC drugs, especially the drugs which contain furosemide. For example, like cold or flu drugs, acetaminophen, NSAIDs, etc., which contain furosemide. So you have to avoid these drugs strictly. And you have to take the food rich in potassium, which are which I'll show you, and you can take this one with you when you go home. And for especially the green leafy vegetable, banana, pumpkin, pomegranate, peas, coconut water, potato, etc. And these are highly rich in potassium, because the due to the effect of furosemide you lost the potassium. It is most important that you take this food. And I have a browser with me. I have written everything here about the drugs and everything, its side effects, about the helplines, like when the overdose or happens, like all the helplines and the numbers are available here. You can take this one along with you, so that like you will be more aware about this drug. And if you have any doubt and concern, you can come along with the next time when you come for the next appointment.